Hi, I'm Dr. Mayank. Today we are going to bust 9 commonest myths regarding hair loss. So stress basically is something which is a part and parcel of every one of us. What we need to understand is any kind of a gross stress which is extremely acute in nature can cause excessive amount of shedding 2 to 3 months after the event that happens. That is not going to be responsible mostly for causing hair loss. Hair loss can be a result of acute stress which goes into a prolonged stage where the shedding continues for months together, which gives rise to a condition in medical terms called as chronic telogen effluvium. If this persists, then it can lead to hair loss. Otherwise, stress is not something which would be one of the culprits. Many people have this misconception that hair loss happens because of excess testosterone in the body. The myth related to high levels of testosterone for male pattern baldness is totally incorrect. Male pattern baldness happens because of the sensitivity of the receptors of the follicles in the recipient zone, which is from the front till the crown of an individual, but it is only because of the sensitivity. It has got nothing to do with the amount of testosterone or the dihydroxytestosterone levels in an individual's body. Oiling is not responsible for reducing any kind of hair loss in any individual. Oiling is basically just an element of conditioning the hair follicles. So if you are looking for just having a sheen in the hair, then yes, oiling makes sense. If you already have an oily skin, you would not require any kind of oils to be applied to prevent further hair losses or cure the hair loss as well. What is the ideal dictum that we want to advise to most of our patients is that you apply oil approximately 10 minutes before your shower and then wash it off. Many people have a myth that hair loss is something which happens after an age group of 40 years. So in today's date, we see many youngsters who are in their teen years. There are many people who would have extensive amount of hair loss as well as hair thinning much early because of the kind of lifestyle that we are living, the amount of nutrition that we are consuming in our normal daily routines. As a normal dictum also, if someone is not having a familial history of male pattern baldness or female pattern baldness, every individual would experience some amount of hair loss which starts at 25 years onwards and progresses as we age. So be very clear that it is not a patterned hair loss we are talking about. It is the senile degeneration of hair where it would happen as we age. Many people come to us and ask what should be the frequency of shampooing. I personally advise if you have oily scalp and you are using a paraben sulfate free shampoo, which is meant to be used on a daily basis, mentioned on the leaflet, then that is the product for us. We would come to know what exactly is suiting us in terms of giving the best of the look to our hair. The myth around multivitamins, which we are having day in and day out, where we pop in every multivitamin that is available over the counter or is being marketed, is not supposed to be taken. Multivitamins have no role in hair loss per se. Yes, if you have a deficiency of specific vitamins which have been checked and reported, then we would always advise those basic deficiencies to be compensated by the right multivitamins which are going to be prescribed. Vitamin deficiencies such as vitamin D or B12 could be responsible for hair loss. Biotin is again an over-glamorized multivitamin which is not usually deficient in any individual, and there are several products available over the counter which are talking about biotin being used for reversal of hair loss. There is no such evidence-based scientific study for the same. People have this consideration that if they wear caps, hats or helmets for a prolonged duration of time, it will cause hair loss for them. This is again a myth and not true. Yes, if you want to leave your hair open, you may, but if you are tying your hair up, which could be in a tight pony or a plait, then obviously be very careful because it can cause some tractional thinning in the hairline for the same. If you are using a hair band, avoid using it for a long duration of time, as that could also be responsible for the same tractional alopecia. So interestingly, some people come to us and say, my father or grandfather, no one has baldness in the family. I have not seen anyone bald, but I'm having baldness. Then what exactly is the reason? So first of all, male pattern baldness or female pattern baldness is mostly genetic. And yes, you may not have seen all the generations on either side. It could be from the maternal or the paternal side of genetics, which could also be a contributory factor to have caused that hair loss. Patients have come to us and said, I have been on finasteride and minoxidil and still my baldness is progressing, though I have been taking these medications for over 10 to 15 years. So what we need to understand is that these medicines are meant only to slow down the progression of this hair loss. It is not going to stagnate, pause, or stop your hair loss. Obviously, you are giving your best shot if you are using these medicines, but these medicines also have certain genetic components which would determine whether they are going to work or not work for us as well. So yes, if you want to preserve your existing hair, using these medicines is the best shot, understanding the idea that it may work for us, it may not work for us. So these were some of the most commonest myths that we encounter with from our patients. If you have any queries, concerns, or any other questions which you feel you would like to ask us, please put down your queries in the comment box below and we'll take care that we answer each one of them. So wishing you all the best. Thank you.